there.
Hi.
My name is Lexi. I'm going to be your medical assistant today.
Hi.
Hi. So I need your name and date of birth, please.
Okay. Monique Lombretta's 12/12/1997.
Perfect. And so you are aware that your doctor assessed that you require a bone marrow biopsy, correct?
Unfortunately, yes.
It shouldn't be too bad. I'm going to go ahead and go over the implied consent form with you.
Okay.
And I'm going to have you sign it afterwards. It's just to make sure that you're aware of the procedure and the possible complications, okay?
All right.
So in a bone marrow biopsy, bone marrow is extracted from a bone and is then analyzed and examined at a tissue level and microscopically. Most common samples are taken from the pelvic bone, and this is where the doctor will be taking yours today.
Oh, man. Okay.
The purpose of the procedure is to diagnose a number of conditions and disorders, including lymphoma, leukemia, multiple myeloma, anemia, and pancytopenia.
Wow, that is so much information.
Yes, it is.
How long is this going to last for? Because I have a hot date tomorrow.
The procedure should only take about 30 minutes.
Okay, that's good. It's not too bad.
It's not. So first, the skin is going to be disinfected, and the site where the sample is to be taken from is going to be numbed with local anesthetic, so you shouldn't feel anything.
Okay, that's good.
You will have to wait a couple minutes to let the local anesthetic set before the doctor will even try to take your bone marrow. The doctor will use a special needle that is meant to puncture the bone and use a syringe attached to that puncture needle to extract just a tiny amount of blood from the bone marrow. This is typically where the most discomfort is caused during the procedure.
Thank goodness you guys are drugging me.
Exactly. The anesthetic should help you not feel a thing. So during this time, the doctor will use a special instrument to remove a small piece of bone along with bone marrow. This is for the biopsy. There's typically no pain for this part of the procedure, so don't worry on that part. The biopsy is low risk, however, there are possible complications that include bleeding, infection, bruising, and inflammation at the extraction site, okay? Rare cases include soft tissue and nerve damage, numbness, and long-lasting pain and inflammation, respiratory impairment of function, or respiratory arrest can occur with administration of sedatives or medication, like any procedure, but it's very rare. And in severely rare cases, injuries can be associated with organs close to the extraction site. That would require additional operations, but like I said, it's severely rare. So you're going to need to be on bed rest after your procedure for at least 24 hours. Okay?
Okay.
And after 24 hours, you're going to need to remove the dressing and observe for signs of unusual bleeding, infection, and any other drainage of or body fluid on the dressing.
Think I can manage that?
Yeah. And it's going to be common to feel really sore or bruised for several days. So that hot date you're going on, you might feel a little sore afterwards.
Oh man, maybe I should reschedule that.
Some people are pretty good with the pain afterwards, but some people need a couple days to recover. If the pain or discomfort lasts for more than several days, go ahead and give us a call. Or if your dressing has any weird fluid or unusual bleeding or anything, I would definitely give us a call, okay?
Sounds good.
All right, do you have any questions?
No, you gave me enough anxiety.
The doctor can also give you something for that. So go ahead and sign for me right there. Perfect. And the doctor will be in with you shortly, okay?
Thank you.
You're welcome.